Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding anatomy, where we will be mainly talking about the classification of receptor by stimulus baroreceptors. Okay, so here in this session we will talk what is baroreceptor, how it is utilized, and what are the functionality. Okay, so we'll start from the definition. Firstly, I'll explain you the definition of it. Then we will see the types, and along with the types we will see the location as well as the overall structure of the baroreceptors. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then things would be much more easier for you. And for that, what you can do, you can also refer the Texture Myth digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can consume the content, and in case if you have any queries related to that, feel free to reach out to me through comment section. I would be more than happy to answer all your questions. Okay, alright, so let's see what is baroreceptors. So baroreceptors are just a sensory receptor that detect changes in blood pressure by sensing the degree of stretch in the walls of the blood vessels and the heart. Okay, so this is basically a sensory receptor that can detect the changes in the blood pressure by just sensing the degree of the stretch in the walls of blood vessel and the heart. Then later it converts that mechanical stretch into nerve impulses that are sent to the brain to regulate the blood pressure. Okay, so now some of you might be thinking like, what is the meaning of baro? So baro is just a word that comes from the Greek word meaning pressure. So baroreceptors are literally the pressure receptor. Okay, so it is just a pressure receptor. So we can conclude that pressure detecting receptor that monitor blood pressure by sensing the stretch in blood vessel is called as baroreceptor. Okay, now there are few classification importance of baroreceptor. Like here you can see, baroreceptors are actually a specialized type of mechanoreceptor because they detect mechanical stretch of blood vessel walls caused by the blood pressure changes. Okay, however they are classified and studied separately. Now some of you might be thinking like, mechanoreceptor we have already covered, then why we are learning this separately, why it is not considered at that part? Because there are some reasons. So what are the reasons? They detect a very specific type of mechanical stimulus, that is blood pressure. They are located in a specific vascular location, not in the skin or muscles. They serve a very specific physiological function, blood pressure regulation. They are the most autonomic involuntary nervous system control of the cardiovascular system. So these are the reason, that's why we are studying it separately. Now let's see what are the location of baroreceptors. So baroreceptors are found in a specific location in the cardiovascular system. There are two primary locations, which is carotid sinus and aortic arch. So for carotid sinus, it is located in the wall of internal carotid artery, just above where the common carotid artery is divided into internal and external carotid arteries in the neck. Okay, this is the most important as well as most sensitive baroreceptor location in the body. Okay, so remember this thing, this is the most important as well as the most sensitive location. The carotid sinus is slight dilation of the internal carotid artery at this origin, and the wall of the carotid sinus is thinner than a normal artery wall. This is very important, it is thinner than a normal artery walls. That's why making it more sensitive to pressure changes. Isliye that's the reason it is more sensitive to the pressure changes. Next thing says, signals from carotid sinus baroreceptor travel through the glossopharyngeal nerve CN9 to the brainstem. Okay, so this is also important. Now if we talk about the second primary location, that is aortic arch. Here located in the wall of aortic arch, the curved upper portion of the aorta just above the heart, slightly less sensitive than a carotid sinus baroreceptor. Okay, if we compare it, it is slightly less sensitive. Signals from aortic arch baroreceptors travel through the vagus nerve CN10 to the brainstem. Okay. Now there are few secondary locations. So here you can see right atrium and great veins, which detect the venous blood pressure and blood volume returning to the heart. These are some of the cardiopulmonary bioreceptors or low pressure bioreceptor. Okay, so sometime in interview they might ask you what is low pressure bioreceptor, so you have to explain this. Then we have left ventricle, contains baroreceptors that detect pressure during the ventricular contraction. Now we will talk bit about the structure of baroreceptor. Baroreceptor are free nerve endings that are enabled. They are embedded into the walls of blood vessel. They are specifically located in adventitia, outer layer, and media, middle layer of the blood vessel wall. So when the blood pressure rises, the vessel wall stretches. This stretches directly stimulate the free nerve ending. Similarly, when the blood pressure falls, the vessel walls relaxes. The nerve endings are less stimulated. Okay, so these are the structure. And the degree of stretch is directly determine the frequency of nerve impulses sent to the brain. More stretch, high pressure, more frequent nerve impulses. Less stretch, lower pressure, fewer nerve impulses. So these are the two reasons of. Okay. Now we know what is baroreceptor, we know the structure, and we also know the locations. It's time to understand how it really works. So we have two cases. First is firstly we should know about this thing, that is baroreceptor reflex. So baroreceptor reflex, also called as carotid sinus reflex or baroreflex, is the mechanism by which baroreceptor regulate the blood pressure. Okay, it is the mechanism. So we have two cases, when the blood pressure rises or when the blood pressure falls. So firstly we will talk about when the blood pressure rises. So in this situation, when blood pressure rises, blood vessel walls stretch more than normal. Then baroreceptors detect the increased stretch, increasing their firing rate, send more frequent nerve impulses. Third says nerve impulses travel through CN9 from carotid sinus and CN10 from aortic arch to cardiovascular control center in medulla oblongata of the brainstem. Then medulla oblongata process the information and sends the signal to the autonomic nervous system. Then we have its two things, parasympathetic activity increases, heart rate slows down, and cardiac output decreases. And sympathetic activity decreases, blood vessel dilate, peripheral resistance decreases. So these are the things, and at the end blood pressure falls back to the normal. So this is when the blood pressure rises. Second case is when blood pressure falls. So in this situation, blood pressure falls, blood vessel walls stretch less than normal. Baroreceptor detect the decreased stretch, decrease their firing rate, sends a fewer nerve impulses. Then nerve impulses travel through CN9 and CN10 to cardiovascular control center in the medulla oblongata. Similarly here, the medulla oblongata sends signal through the autonomic nervous system. Sympathetic activity increases, heart rate speed up, cardiac output increases. Second, sympathetic activity increases, blood vessel constrict, peripheral resistance increases, and at the end blood pressure rises back to the normal. So basically it is moderating both condition, whether it's a high or it's a low. Okay. Now there is one very important thing about the adaptation, because there are slow, like baroreceptors are slowly adapting receptors, but they do show some adaptation over the time. So let's say there is a patient with a chronic long-term hypertension where high blood pressure is persistently same. So in this situation, baroreceptor gradually adapt to the higher pressure and begin to treat elevated pressure as normal. Okay, so that's a problem. In this situation, it consider the higher pressure as normal if it is constant. Okay, and this is called as baroreceptor resetting. The baroreceptor reset their threshold to the newer higher blood pressure level, and this is the reason why chronic hypertension is self-perpetuating. The baroreceptor no longer trigger the reflex to lower the pressure because they have adapted to accept the high pressure as normal. And this is why blood pressure must be treated gradually. Rapidly lowering the chronic high blood pressure can cause dizziness and fainting because the baroreceptor are set to the higher level. So till now we have learned so many things. So how we will remember it all? So for that there is a few memory tip. I have concluded everything here. So baro means pressure, which is equal to blood vessel stretch. Now think of this like high pressure, vessel wall stretch more, baroreceptor fire more, brain says slow down the heart and dilate the vessel. Lower pressure, vessel wall stretch less, baroreceptor fire less, brain says speed up the heart and constrict the vessel. So these are the overall working. Okay, so and you can also relate the baroreceptor like a garden hose pressure sensor. So when you increase the water pressure, the hose wall stretch, the sensor detect this is a signal, detect this and signal to reduce the pressure. And when the pressure drops, the hose wall relax and the sensor is signal to increase the pressure. The body does exactly the same through the baroreceptors reflexes. Clear? So I think this part is clear for all of you. Now we will discuss the question, and today's question is about the olfactory receptors. So you have to just tell me the exact location of olfactory receptor where it founds. Okay, so you can just share the location. Okay, and please make sure that you comment the answer of this question, because once you comment, according to the comments, like I got the notification, and then only I started publishing the new sessions for the medical coding series, because these notification instruct me that you guys are learning from this series, and accordingly I released more sessions. So please do share your knowledge in the comment section, because it will also help other to learn more better. Clear? So yeah, that's all for today. See you in the next session with new topics. So thank you for watching TechShareBit.